Good afternoon, and thank you for the opportunity to present this quality improvement initiative. My name, as many of you know, is Diana Barlow Deutsch, and I am completing a project as part of my doctoral behavioral health program that I thought would be beneficial for our clinic. So today I will present a proposed quality improvement project that would be focused on health literacy in Oasis Health Clinic here, our primary care clinic. Health literacy is a critical factor influencing our patients' understanding, treatment adherence, self-management, and overall health outcomes. Throughout this proposal, I will demonstrate how a simple evidence-based intervention can improve patient outcomes, enhance patient engagement, and support our clinic's commitment to high-quality patient-centered care. All right, so why health literacy? Health literacy is the ability of a person to obtain, understand, and use health information to make informed decisions about their care. And so patients with strong health literacy are better able to understand their diagnoses, follow treatment recommendations, manage chronic conditions, and take their medications correctly. When health literacy is low, our patients leave appointments confused about what they've been told, resulting in medication errors, missing appointments, not following up on referrals, poor management of their diseases that they're managing, and having preventable complications that we could help with. According to the Center for Disease Control, limited health literacy is associated with poor health outcomes and significantly higher healthcare costs. This makes health literacy not only a patient issue, but also a quality and safety issue for us as a health organization. What's the current problem? So looking at our clinic and observations that we've been making using the Brief Health Literacy Screening Tool, the BHLS, we've identified several concerns. So many of the patients struggle to understand some of the medical terminology and treatment instructions, and this can lead to medication and treatment errors and not understanding how to follow those directions. So even when patients appear to understand information during appointments, they can later struggle to recall it or apply it and put it into action. So the most affected groups in our clinic with the screenings that we've been starting to do is the older adults over age 70 and newcomers to Canada, specifically the Middle Eastern background population that's coming here. So these populations, they often face additional challenges such as language barriers. Oh, sorry, I apologize. Changed the slide there by accident. Effectiveness, they have language barriers, cultural differences that we need to consider, lower health system familiarity, so adjusting to the way that our system is run and how we do things and understanding what's going on. And potentially for some of the seniors we're dealing with, the sensory limitations with their sight or hearing or ability to cognitively take on board certain information. So as a result, these patients can be at greater risk for non-adherence, poor self-management, and prevent their healthcare utilization from being what it should be. So in our clinic here at Oasis Health Clinic, it's a suburban primary care clinic, and we have a diverse population that comes through. The clinic provides family medicine, as you know, chronic disease management, mental health services, and integrated behavioral health care support. Our patient population is adults, typically ranging from young adulthood to older adulthood, and many of whom who live with chronic illnesses such as diabetes, hypertension, chronic pain, depression, anxiety, and other mental health issues as well. In this initiative, we want to align with our clinic's missions and our values. So first, it's important that we support our patients in being patient-centered with their care so that we truly care about them, they truly understand their care plans, and they can actively participate in decision-making. Sorry, I apologize. And we want to make sure that we are not only having them actively involved in their decision making, but that we advance their health equity by addressing communication barriers that disproportionately affect certain vulnerable populations. The support that we want to give them for chronic disease management is important as well, because they need to understand their conditions so that they're more likely to follow their treatment recommendations and engage in self-care behaviors. Finally, In this project, it complements our integrated behavioral care principles, recognizing behavioral change and health outcomes depend heavily on patients' understanding and engagement in their own care. What are we looking at for factors that contribute to the low health literacy within our particular healthcare setting? So language differences can make it difficult for our patients to fully understand complex medical information. Cultural differences influence how the patients communicate and how they understand things from their healthcare providers and whether they feel even comfortable to ask questions. Many of our patients face educational barriers or limited experience navigating healthcare systems. And with our older adults, some are experiencing hearing issues, vision issues, or cognitive changes that affect their comprehension. In addition, our healthcare providers often use medical terminology that patients may not understand. And many patients, they feel embarrassed to admit their confusion or to ask for clarification, which can lead them to leaving appointments without fully understanding the instructions for their care. A strong body of research supports improving health literacy is a really great quality improvement strategy. So the research consistently shows that patients with limited health literacy experience poor health outcomes, increased hospitalization rates, lower medication adherence, and greater healthcare costs. So through the AHRQ, which is the Health Literacy Universal Precautions Toolkit, I was able to look at with my research process. They recommended that healthcare providers assume all patients may have difficulty understanding health information and use communication techniques that improve comprehension. And so with this initiative and looking at these improvement standards for health quality and equity, these national standards and priorities focus on patient-centered care like we do, health equity, safety, and improved population health outcomes by working a little bit extra, not too much, but a bit extra to make sure that there is that understanding. Successful implementation requires that we all engage in this and we have all the stakeholders involved, so multiple stakeholders. So we need our physicians to play their role by providing the medical education and treatment planning. We need our nurses reinforcing that patient education and identifying, any comprehension challenges during the visit. We need our behavioral health providers to support with communication strategies, staff training on some methods that we'll talk about, and patients' engagement in their own care. So with our administrative staff as well assisting, we'll be doing screenings of people's health literacy levels and making sure that it's documented that we've been using certain interventions, whether it's written materials that are readable for many different populations, depending on language and literacy issues, but also that we have documented that our patients and providers have done the teach back method that we'll talk about, and helping our clients to tell us back what they hear and that they are understanding what it is that they've been learning about their care. So patients and family caregivers are really important stakeholders as well, because we want them involved so that we can make this work and that they're getting what they need. But ultimately, the support of Dr. Alawazi and the clinical leadership team will be a critical part of the implementation process, and that it's sustainable outcomes. So what is the goal of this initiative? The goal of this project is to improve health literacy among adult patients identified as having lower health literacy levels through that brief screening inventory. The intervention combines 4 evidence-based strategies that are known to improve health literacy. So the screening that we'll be doing with the brief health literacy screening. And then the second would be that teach back communication method that I will be teaching you and supporting you with, and using plain language education materials that will be in different languages of the populations that we serve so that they have their first language option. And also using some visual learning and support aids that we can put in place for some of the chronic diseases that we manage day in, day out, and helping people understand. So this pilot is meant to run for 6 months, allowing us significant time to evaluate the outcomes and determine the effectiveness before it becomes broadly implemented across our Oasis Health Clinic. The intervention begins by identifying patients who may need additional support with the BHLS screening we've been talking about. Patients with the low scores targeted for education will be using the plain language materials and visual supports that we're putting together, and the providers will be using the teach back method to ask the patients to explain the information in their own words to confirm their understanding. Interventions will be documented within the electronic medical record system. So that allows us to track the progress and the continuity of care, and also be able to see the outcomes of these interventions with our clients' continued health and supporting their health, and how that can be seen. And our primary goal is simple. It's going to be to ensure that the patients truly understand their care plan before they leave our clinic. The workflow. All right, so the workflow. So during the visit, the patients will complete their BHLS screening. If the low score is identified, the patient will receive additional education support from the nursing staff or our DBH behavioral health provider team. The teach-back method is then used and reported in the electronic medical record that it was used. There's follow-up assessments where we will monitor the patient's progress, identify ongoing educational needs. And importantly, this process builds upon existing workflows rather than creating an entirely new system. So it's something that can become, habit and commonplace from their intake throughout their treatment. And the staff roles. One strength of this initiative is that the responsibility is shared amongst the whole team, so it's not falling upon one individual. So with the medical office assistants distributing the screening forms during the check-in, the nurses and the doctors of behavioral health reinforcing the education and making the time for the patients that are identified needing additional support. I will be providing, as the behavioral health provider, staff training, quality improvement monitoring, and implementation support. So I'll be there to rally and support everyone. And the physicians will integrate the teach-back method into their routine patient encounters and make a quick documentation on the checklist for their sessions that they have completed this. And by distributing these responsibilities across the team, the initiative minimizes the burden on any single team member and promotes us having that collaborative care and helping our patients to understand what they need. For educational materials, we will be designing some that improve our accessibility for our patients and understanding their chronic conditions. The materials will be written at around the grade 6 level so that it covers a lot of different literacy levels in our patients, and that it's quite simple and teachable for them to understand, and it'll be consistent with the health literacy best practice principles. There'll be visual aids and diagrams that'll help us reinforce some concepts and help with our treatment planning with our patients and helping them understand some of those behavioral health components when it comes to self-management of their chronic conditions. And we'll have multilingual resources available for patients in their first language of choice, not just English, and focusing on chronic disease management, medication, best practices, self-care strategies, follow-up instructions for certain referrals that we'll be putting, that we commonly put in place. And these supports help patients understand information regardless of their level of education or language proficiency. For training, to be successful in this implementation, I will be conducting 1-hour training sessions covering health literacy principles and how to use the screening tool, the BHLS, teaching back communication techniques, what we'll be requiring for documentation, and how to be culturally responsive in our communication. So this training will emphasize practical skills that you can use immediately and apply to your patient encounters immediately. And there'll be ongoing and coaching support if any challenges are coming up or you just want me to review things again. I will be available throughout the pilot period and beyond to address questions and support the consistency in how we're delivering these. For policy changes for long-term sustainability, we will make some policy changes eventually here in the patient education communication policy. And so we want to update it to incorporate routine health literacy screening ongoing. And with this, the health literacy universal precautions policy will also be in place. This embeds in our clinic the practices that help ensure that there is improvements continuing ongoing in people understanding their medical conditions and what's expected of them and how to do their best for the best health outcomes with whatever diagnoses they have. So in this initial pilot phase, we'll be creating these standards of care and tweaking them and making sure that they work and removing any barriers and making them work as efficiently as possible for all of us. And we'll be doing that with continued measurement and evaluation. So we'll determine whether the intervention was successful and look at the outcomes. We'll be monitoring And the primary measures that we'll be using to monitor will be the BHLS scores, plus our patient satisfaction surveys on how they're finding it, and understanding of our care plans and how the teach-back methods are documented. We can look at whether that's happening, how often it's happening, what is the compliance, if there's any follow-up needed or any adjustments needed to make it easier to comply. And so potentially there'll be a reduction in clarification calls from our patients, and our patients will be getting what they need when they're here, so they'll feel more confident that they understand their health condition and their interventions and treatment. So monthly, I'll be doing a chart audit so we can assess the fidelity of the interventions, and we'll do formal evaluations at 3 months and 6 months in this pilot project to measure the progress and create any adjustments that need to happen within how we're doing things to make it work better for everyone. We anticipate meaningful interventions in patient understanding and engagement, meaningful improvements in patient understanding and engagement with these interventions. And based on the published literature and similar interventions, we expect adequate health literacy rates to increase in approximately from about 45% where our baseline to 60% in the next 3 months and 75% in the next 6 months. And if we can go higher than that, that's even greater. So improving health literacy will lead to better medication adherence, improved chronic disease self-management, fewer clarification calls, greater patient satisfaction, and ultimately, these improvements contribute to better health outcomes and more efficient healthcare delivery to all of our patients. To keep this being sustainable and moving through these steps, if approved, the next steps would be staff training and workflow presentation, and then looking at electronic medical record prompts that will be activated to support screening and documentation. At that 3 month, 6 month mark, we will be looking at the results. We'll be doing our monthly plan, do, study, and act cycles to evaluate our progress and make improvements. And if outcomes are positive, the interventions can be expanded across the clinic. Our long-term goal is to make health literacy practices a routine and standardized component of patient care within a year. This is a common concern when implementing these kind of quality improvement processes is how much work extra will you have? And so initially, we may have a small adjustment period where this new communication techniques and documentation procedures is an adjustment for us. The research does suggest that teach-back adds only a few minutes to the patient encounters and often saves a lot of time for all of us later on. And when patients understand their care plans, providers do receive in the literature fewer clarification calls, they experience fewer repeat explanations and visits, and they see more improved adherence by our patients. Overall, the improvement of understanding actually increases efficiency and reduces avoidable workloads for all of us as we get this into practice. Why am I the one here to teach on this initiative of health literacy and to provide this training and follow-up? The reason is with working on my doctorate of behavioral health, I'm in a unique position to lead it because health literacy sits at that intersection between communication, behavior change, healthcare quality, and interdisciplinary collaboration. So a doctor of behavioral health is trained to improve patient engagement, facilitate behavior change, design quality improvement initiatives, evaluate their outcomes, and work across the medical and behavioral health settings. So I'm specifically trained to improve in this kind of a project where health literacy is about providing this information in the ways that we can to help patients understand, retain, and act on the information. And because of my competencies in these areas, I'll be well suited to lead this implementation and to provide training to our staff on these aspects of evaluation and sustainable efforts for change management. I appreciate your time, and I'm here for questions and comments and ways forward. And I have some great literature that I've used in creating this initiative that would be very helpful if you're interested in having a look with some of those outcomes and stats that I mentioned of improvements that happen in health literacy with some of these interventions. So please reach out, and I'm here to support you, and we will figure out how to make this successful.